Thank you so much. And welcome to our session. I'm Jerry Rosenbaum, Stanley Cobb Professor of Psychiatry at Harvard Medical School and Emeritus Chief of Psychiatry at Mass General and Director of our Center for the Neuroscience of Psychiatry. So as you heard, this panel session today is entitled Technology in Psychedelic Psychiatry. And I'm guessing for some of you that sounds vaguely oxymoronic, especially if you associate psychedelics with the 60s retreat from the industrial state meritocracy, or even earlier in the history of humanity with hundreds or thousands of years of spiritual and ritual and healing activities across various human societies or indigenous populations. How could technology be relevant for that? But psychedelics have lately emerged in a vast landscape of mainly commercial therapeutic innovation on the path to FDA approvable drug development as a next generation of psychotherapeutics, but also as a scaffold for neurochemical innovation for possible generations of therapeutics to come. And in the process, companies are creating billions of dollars of new valuation and investments in this space. Academic centers, including those with longstanding efforts in this field and others more new to the topic, have been pursuing science to understand these drugs further. At my institution, for example, a number of researchers, programs, and labs have joined together to create a Center for the Neuroscience of Psychedelics to work to understand deeply how these agents might allow the brain to change or heal. And at our Mass General CNP, neuroimagers, neurochemists, chemical neurobiologists, cognitive neuroscientists, regenerative medicine scientists, and clinical researchers have come together in the conviction that studying these mechanisms may one day lead us to a better understanding of brain disease and recovery, and potentially to discover novel therapeutic approaches. And like all our current treatments with potential to heal the brain from depression and related disorders, psychedelics are relying, at least in large measure, on the ability of these agents to robustly induce a state of neuroplasticity. This induced neuroplasticity creates opportunity. And if we understand that opportunity correctly, it can also be squandered, because an opportunity for new learning or transformational emotional change does not necessarily of itself ensure success or a positive outcome unless other conditions are met. And that is where the promise of technology to enhance the likelihood of success and the likelihood of durable success comes into play. Today, we have an outstanding panel of important contributors in this endeavor, and it's my pleasure to introduce the chair of today's session, Dr. Mason Marks.